Hola, buenas tardes.
My name is Christy Lafferty, and I'm the Director of Development and Communications here at AMOS Health and Health.
My name is Ymer Sanchez, and I am a relations coordinator here at AMOS.
So some of you may know us and some of you may not, but AMOS Health and Health is a nonprofit Christian organization that works to reduce health inequities in Nicaragua by training local leadership to prevent disease and save lives. And Jomar, we are in an exciting week here at AMOS.
Absolutely, yeah. We're hosting our annual health promoter training this week, and we are having a great time with all of them. Yeah, absolutely. And today we have a special guest, and let me introduce to all of you Dr. Emil Olivieri.
Hi.
He's our health program manager. He's been serving AMO for 2 years. He and his team have been doing a great job, and we are very grateful for all of that. So we have a few questions for him, and the first one is, tell us what happened this week. Why does AMOS gather all the promoters this week here in Managua?
So, AMOS is always targeting excellence through continuous education and assures that health promoters are involved in the different process and decision making. So, this week we are presenting them the results of different evaluations, assessments, census questions applied to the different communities and come together with answers and solutions to target actual needs and our actual context.
Yeah, that sounds great. That's very important for AMOS as an organization and all the promoters from the other communities. And what are some of the main goals that you and your team hope to achieve this week?
So we have defined three main goals. The first one is understand the main challenges that our health promoters are facing in their communities to serve others. Our second main goal is to analyze the results of the recent surveys we have done per community to recognize or to know more about signs of alarm in pregnancy, postpartum, and childhood, and how to address the three delays in maternal mortality. And the third main goal is to have continuous education and improvement in data collection and redirect all these actions in the community towards evidence-based data.
Absolutely. Yeah.
That's awesome. There's a lot that you just shared with us, a lot you guys have been covering this week. One thing that caught my attention, you just mentioned something called the three delays. Can you tell us a little bit more about that?
So what are the three delays, right? So the first delay is to decision to seek for health care, which is more about recognizing the signs of alarm, knowing where to go, and then we have this second delay, which is reaching the care, which people usually, in rural communities, the health centers or the hospitals are very far away, or there's no road access. It's very hard for them to have the mobilization. And then the third delay is more about receiving adequate health care, right? Quality in time. So this is very important for them to be able to recognize what is happening, what actions do I have to take when this happens, where do I have to go, and what are my rights, and what attention do I have to receive just in time. So.
Wow. It seems like a very intense week and a lot of work. Is there any free time for them?
Well, yes. For the health promoters, they actually do very intense work during the year. They do a lot of efforts in serving their community. So we've prepared like a beach day, which took place yesterday.
Is here with us to share a little bit more from her perspective, her experience this week. So we have Yadira Sevilla, who is going to introduce herself, and I'm going to share some questions, and then Jomar is going to help us translate.
Yo estaré traduciendo para las preguntas que va a estar haciendo Christy hacia usted, por supuesto.
So Yadira, could you introduce yourself and tell us how long you've been serving in your community?
¿Puede presentarse y decir por cuánto tiempo ha servido su comunidad?
Bueno, mi nombre es Yadira Sevilla Arauz, promotora de la comunidad Tierra Blanca, actualmente egresada de la Universidad de Enfermería y tengo 14 años de ser promotora de salud en mi comunidad.
So my name is Yadira Sevilla. I'm from the community of Tierra Blanca in the department of Huaco. And actually, right now I'm a graduated nurse, and I've been serving my community for 14 years so far.
Can you tell us, Yadira, a little bit more about your role as a health promoter in your community?
¿Puede explicar un poquito sobre su rol en su comunidad como promotora de salud?
Nuestro trabajo pues es trabajar con las personas vulnerables, con las embarazadas, niños y pacientes crónicos.
Our role is to work and serve the vulnerable people in our community, pregnant women, and also kids in our communities.
También atención durante la casa base, donde podemos ver planificación familiar, consejerías y charlas educativas a las personas que asisten durante la consulta.
And also we work in a community clinic where we attend patients, we help with providing birth control, counseling for the people who are at the clinic, and also they support with a lot of educational for the community, and people from the community.
Y también trabajamos con los niños de la escuela, donde damos charlas educativas sobre temas muy importantes para los niños, como la importancia del lavado de manos.
And also we work with kids from our local school, providing education about hygiene, like hand washing for the kids, which is very important, for the kids in the community.
Wonderful.
Muchas
So,
gracias.
another question that we had for you is, what does it mean for you to be here this week at the training?
Otra pregunta que tenemos para ustedes, ¿qué significa para ustedes estar en esta semana, verdad? ¿Qué ha significado para ustedes estar esta semana aquí en la capacitación?
Como promotor es algo muy importante, es una vez al año que estamos aquí, donde nos capacitan sobre temas muy importantes para ir a ayudar a nuestra comunidad.
As a health promoter, it's very important being here at AMOS once a year, where we learn different topics related with the work that we do in our communities, and then we're going to implement all the knowledge that we are receiving this week in our communities and serve our communities.
En temas muy importantes, por ejemplo, para personas más vulnerables como los niños, estamos viendo sobre salud dental, que es muy importante tratar a los niños en esa etapa, y también en nutrición durante los embarazos y los niños menores de 5 años, que es donde nosotros podemos prevenir enfermedades para futuro.
And now we are learning about the most vulnerable people in our community, for example, kids. So this week we have been learning about dental educations for kids, which is very important. And also we have been learning different topics about counseling and education for the communities.
Awesome. Well, Yadira, there are people watching who may have a connection with AMOS for a while. Other people may be seeing it for the first time, but there's a lot of people who make this work possible through their financial support. Would you want to say any words to speak to them, the network of people that make this work possible?
En este momento hay muchas personas observando este en vivo que estamos haciendo, ¿verdad? Muchas personas que apoyan mucho esta capacitación, apoyan mucho al promotor de salud. ¿Tiene algún mensaje que le quisiera dar a todos estos donantes que siempre nos están apoyando?
Primero agradecerles mucho por su apoyo durante todo este tiempo y pedirles que nos sigan apoyando. Venimos de unas comunidades de difícil acceso, donde los servicios de salud no son muy buenos, entonces que nos sigan apoyando para nosotros seguir ayudando a esas personas.
So first of all, he says, I would like to thank you all. I'm very grateful for all your support, and I would ask to continue supporting our communities, our programs. I'm very grateful for that, and also thank for your ongoing support to all our communities and our programs.
Y el aporte de ellos es muy importante, tener un promotor de salud en la comunidad. Esto ha venido a mejorar la salud de nuestras comunidades y su ayuda y su aporte es de muy importancia para nosotros.
So your support is very important because in our community we don't have all the access to healthcare, and having your support is a way to provide this access to our communities and through our programs.
So thank you so much, Yadira. Muchas
Muchas gracias.
gracias. Thank you for being here with us today.
Thank you.
So thank you to all of you who joined us today for this brief look into our annual health promoter training. And we have a quick invitation for you as well. This year, AMOS Health and Hope is celebrating our 15th anniversary of our work here in Nicaragua. We're having a special celebration coming up on Saturday, October 15th, and we're excited to see all of you who are going to join us in person in Pompano Beach But for all of you who may not be able to be with us there in person, we are also going to be live streaming parts of the event, and we'd love for you to join us. So you can check us out on YouTube, on Facebook, on our social media, on our website. We'll have all that information for the links and how you can join and be a part of our celebration of our 15th anniversary next weekend.
Yeah, well, thank you so much. Yeah.
Have a great
Bye,
day, everybody.
Thank you.